In some ways we're making progress, definitely, and there's some amazing stuff going on. But I do have a real worry that as we're winning, which I believe we are, we're winning the battle on stigma and taboo, we're winning the battle for better awareness, better understanding, better appreciation of the issues, but that sometimes leads to people saying, right, okay, oh, that's interesting, maybe that's me, I'll go and see my GP. Mm-hmm. And the GP says, yeah, I think maybe you do have a mental health issue that maybe we could take a look at. Maybe we should refer you to a specialist. It's going to take you X months. So, and I think that's what leads to a situation where we only deal with people when they're in crisis.
As we start to get everybody working together and rethinking the way services are delivered, and doing that with patients, with service users, with the voluntary sector, we can do this so much better. Now, bringing people back and ending the out-of-area placements, that's, if you like, that's the most visible problem. And I'm not surprised people are campaigning about it, because it's a nightmare for patients and for their families and friends. But in order to solve that problem, I think we probably, clearly we need more places for those people in Norfolk and Waveney. But we also need to do some other things, so that when you go to your GP with a mental health problem, ideally you need to be seen by a mental health community worker in the practice or in a nearby community hub. It may be, certainly in Norwich, we're going to have a wellbeing cafe that'll be a sort of port of first call for people, and can also help deal with people in crisis, so that you don't get people really getting little or no support until they end up either in A&E or we're still in a police station.
Partly a response, I think, to the current government trying to unbundle some of the pretty disastrous changes that were made by under Andrew Lansley. And also, I do think, I mean, you probably saw there were some protesters outside, and on the one hand they're saying services are terrible, and on the other hand they're saying we don't want any change. Well, there's a kind of bit of a big inconsistency in that. If they're not happy with the services, then at least look at some of the changes that are being made. And so, no, I do see, look, ultimately, everything is political. People say take the politics out of the health service. If you have fundamentally different views of how the health service should be across the political spectrum, it is political. But there is at least still, despite I think the hard right in our politics trying to undermine the health service, there is massive support for the principles, the founding values and the principles of the health service.